acknowledge the traditional owners of the land on which we meet, or at least we meet down here, with some of us on the land of the Wurundjeri people of the Kulin Nation. We recognise their continuing connection to the land, waters and culture. We pay our respects to their elders, past, present and emerging. Like Indigenous nations in Australia, Timor-Leste is a country affected by the legacy of colonisation. One of these impacts is health disadvantage, including the devastating rates of rheumatic heart disease in East Timor. We commit ourselves to action on this injustice. Particularly like to welcome a few notable people. Everybody, I think, connected as a VIP to us. Like to welcome Dr. Maria de Araújo, who's the former Prime Minister of Timor-Leste, former Health Minister and former Deputy Prime Minister, also a panelist tonight. Kirsty Sword-Guzmau will be logging in. I think she's on another session with another webinar just before. Her Excellency, Ms. Ines Maria de Almeida, the Timorese Ambassador to Australia, welcome. His Excellency Peter Roberts, Australian Ambassador to Timor-Leste, welcome. Her Excellency Ms. Maria Alves, Timorese Ambassador to Malaysia. Her Excellency Elisa de Silva, Acting Timorese Ambassador to Thailand. Peter McMullen, good friend of East Timor Hearts Fund and Honorary Consul for Timor-Leste in Victoria. Welcome, Peter. Dr. Rajesh Pandav, who's the WHO country representative for Timor-Leste and also a panelist tonight. Alzira dos Reis, East Timor Hearts Fund Board Advisor and panelist tonight, welcome. A moderator for tonight, public health professional Sarah Moon. Thanks for all your help in organising tonight, Sarah. And a special welcome to our co-founders, Dr. Noel Bailey and inaugural board chair, Ingrid Svensson. Welcome. We also welcome all our friends and colleagues in Timor-Leste and around the world, including people from 16 countries who are joining us tonight. We welcome our supporters, our volunteers, our partners, including our friends at Moloch Timor, including Dr. Jeremy Beckett, and our board and committee members who are logging in tonight. Welcome, everybody. Next month, we commence our 10th year of operations at East Timor Hearts Fund, and we're well known for our cardiac screening clinics run with our volunteer cardiologists, and also for bringing young Timorese patients to Australia for life-saving heart surgery. Over the years, we've broadened our scope, performing 10 PDA surgeries in Timor in 2018, running a penicillin RHD prevention program with Moloch Timor, RHD and heart health research, education and prevention work. But at the moment, COVID-19, as many of you know, is affecting our clinics, surgeries, face-to-face fundraising and meetings, as it's affecting many organisations around the world. Meanwhile, thanks to Moloch Timor, our penicillin program continues. A regular clinic was held in February, and we completed 3 life-saving heart surgeries in March. I think at least one of the patients is logging in tonight, so welcome if you're here. We're adapting with online clinics planned for next month. We've provided quantities of PPE a couple of months ago to help frontline healthcare workers. And we just put an order today for Busy Bee needle pain relief, which is to help with the penicillin program so that the kids don't get as much pain from the injections they have to get each month. It's not great for kids to be getting pain, particularly when they've got serious heart conditions, and it helps ensure that they turn up to get their injections each month, which is required to help prevent rheumatic heart disease. We also have a new strategy plan to be developed in the next couple of months to take us into the future. And we'll be starting to celebrate our 10th year of being in operation next month, and which is why it's particularly exciting to have Noel and Ingrid joining us tonight. We're part of a community that cares about health and welfare of the people of Timor-Leste. We're based in Australia, as most of you know, but our supporters are all around the world, as tonight's audience proves. The purpose of this online panel discussion is to bring our community together to hear about the amazing work that has been done in Timor-Leste to help keep them safe during the pandemic. At the moment, they've had 26 cases confirmed, no deaths, no community transmission. Very different situation to where many of us are hooking in from tonight, particularly if you're in Victoria. That seems like a dream. The risk profile in Timor-Leste due to the high levels of rheumatic heart disease means that it would be unthinkable if there would be an outbreak in Timor. So there were very quick closing borders. They've had a lot of focus on prevention and preparation, and we felt there was a great lesson to be learnt by hearing what was done in Timor and having a bit of discussion about what's been going on the ground. To start things off, I'd like to introduce His Excellency Peter Roberts, Australian Ambassador to Timor-Leste. Peter's been Ambassador to Timor since February 2018. During this time, Timor and Australia finalised and brought into force the Maritime Boundary Treaty, and Australia's Prime Minister, Foreign Minister and Defence Minister all visited to commemorate the 20th anniversary of Timor-Leste's independence referendum. Australia's Timor-Leste's largest development and security partner, and Peter has previously served overseas at the Australian Embassy in Japan, the High Commission in Samoa, and as a senior civilian monitor with the Peace Monitoring Group in Bougainville. So, Peter, how have Australia and Australian NGOs been helping on the ground? You might need to unmute yourself.
Unmute.
Well done.
Oh, I'm glad that I'm the first person. First speaker has failed to unmute themselves. It's a good start. Thanks very much for having me, David. And it's great to have so many people around the world and in Timor-Leste. And a special hello to everybody back in Melbourne. I know it feels like you must be all doing it tough. David, you give me 5 minutes and I'll try to be absolutely ruthless with myself because you've got so many great speakers coming after me. So I'll talk a bit about Australia and Australian NGOs in Timor-Leste, but I can't talk about all of it. We'll be broad brush. But if people want to go to the Australian Timor-Leste Facebook as well, you can see a lot more detail about stuff that Australia officially has been doing. And look, also I feel a little bit awkward as the first speaker because talking about what Australia and Australian NGOs have done because, as you say, Australia is Timor's biggest donor, and a lot of Australian groups have worked very closely up here. But Timor's success on coronavirus to date is Timor's success. It's Timor's structures, it's Timor's systems, it's Timor's leaderships, and it's Timor's decisions. So I'll talk about what Australia is doing, but I want to make sure that I'm talking about it in that context. And I think that's actually a very key point, actually, because a theme for us in working with Timor-Leste is that we want to get behind the Timor-Leste response to work within the Timor-Leste system. So it's great to have Dr. Rui here tonight. And of course, Dr. Rajesh, WHO has been central to all of this as well. But I think a special thing about Australia and Australian NGOs in Timor-Leste is that we're deeply embedded. We have existing structures. So when we talk about working through Timor-Leste systems and getting behind Timor-Leste's response, we're in the fortunate position that we have a big presence and we work across sectors and that we have good existing relationships, be it the government, be it NGOs like East Timor Hearts Fund, so that we can work within existing structures and adjust quickly. So, for example, on health, and I'll talk about other issues as well. It's not just health, and I think that's been a key feature of TimorLestes Response. But on health, because we've got good relationships and know the minister, but also at the working level, the Ministry of Health, we're able to adjust quickly to Timor's responses. For example, in consultation with Maluk Timor and WHO, renovating the Veracruz Health Clinic, which has now been the clinic that's all COVID patients have gone to. And I think you've got Maluk Timor and Menzies and others on the line tonight. So it's been very exciting to have these existing partners that we have in Timor-Leste with existing programs that we've been able to pivot or bring forward to respond to COVID. So, of course, Menzies already doing great work, infectious diseases, and on the laboratory, able to bring forward work there to support capacity of testing in Timor-Leste, and now capacity of over 200 tests a day. Maluk Timor, good partner of the Australian government, good partner of East Timor Hearts Fund, already doing work on infectious diseases, on education and training in Timor-Leste. So we're able to bring forward the work they're doing and reach out to a lot more people on training and capability building. But I mentioned it's not just health, and we've got Dr. Rui, who of course led the CIGC, the Integrated Crisis Coordinating Mechanism there. I think a key feature of this response in Timor-Leste has been it cuts right across government. And we also work across government with Timor-Leste, so it's been great to be able to be involved in that. So in the CIGC, we've got a defence team up here, good at logistics, have some technical skills. So we were able to embed defence people within the CIGC. Same as our AFP, our Australian police up here. P&L is so important, and Timorese police so important to the response. So have been able to adjust what we do to support that. So, just last week, our police were out hiking the hills of the border with Indonesia with the P&L, locating sites for new border posts, because it's so important to control that border. And David, I think you made a really good point about the risk profile of Timor. So across the government, Timor-Leste has been working to build resilience, and we've been able to shift our programs to get behind that. So in our agriculture program, we've been able to focus more on food security. Timor-Leste made a very ambitious social payments move, payments of $100 a month to over 300,000 families, which is so important for building resilience, having money in hand, being able to use, get access to healthcare, access to food. So we were able to bring in technical support and training and capacity building there to support that process that Timor-Leste is working on. And the same as using the Village Development Scheme, another Timor-Leste government-run program that we're able to provide technical support and extra funding to support. So now we're in a planning stage. We had a big meeting with the line across all our government agencies a couple of weeks ago to look at what Australia should be doing from here on in, because of course we're going to keep working on the health, but of course we've got to work on the social and economic impacts as well. I know I've already done 5 minutes, but I'm going to mention the Australian groups, because there's so many Australian groups who are so active up here. And of course, these established groups with good connections are making a real difference. So, East Timor Hearts Fund, obviously well linked into the system. And David, I think you set up the most colourful PPE in the world I've ever seen. But obviously able to use your systems to make a contribution there. So many friendship groups between Australia and Timor-Leste, and we know friendship groups have been doing on-the-ground work, being in sanitation, or education, that's been making a big contribution. And also just normal Australians, not in any groups, but a couple of days ago, Dr. Rajesh and I were with the Minister of Health, opening up a big container of PPE that UNICEF had brought over. But it was a significant part of that funding was from the UNICEF fund, from UNICEF Australia, ordinary Australians contributing and making a difference up in Timor-Leste. So look, that's such a very quick summary, but I've actually done my 5 minutes. I will mention one other thing. it's been very tough, of course, for everybody working on on COVID, but there's been, I think I'd like to end on a positive note. So there's a lot of great stuff that we've been able to learn from this. And I think it's very exciting for us into the future. You know, the focus has been on wash, on sanitation. You know, if we can translate this into the future in our work in Timor-Leste and everywhere else, it's going to have great health benefits. The contact tracing and the surveillance and vigilance team up here in Timor-Leste has done a fantastic job. So how exciting will this be when we think post-COVID, what we can do on infectious diseases beyond that? So we've got a lot of work still to do on COVID, but I think there's a lot of exciting stuff that we can take from this as well and do more in the future. Okay, 6 minutes 30. That'll be me. Thanks,
Done
David.
well. Thanks very much, Peter. Thanks very much for that overview. And if people want to know more, just check out Peter's Twitter account and scroll through, because he tells you what everyone's been doing, and the UNICEF and the pictures are fantastic. I'd like to introduce Sarah Moon, our moderator for this evening, who's a public health professional and now a great friend of East Timor Hearts Fund, and will be leading off things from here.
Thanks for that, David. I feel really privileged and happy to be here amongst so many old and new friends. It's a strange medium to be in, but it's lovely to see everyone. And I'd also just like to reinforce the East Timor Hearts Fund's gratitude to our three distinguished panelists from Timor-Leste, VIPs from across the world, and also all attendees for making the time to be here. Before I introduce our three panelists, there's just a couple of protocol-based things I'd like to go through. Each of the three panelists will have 10 minutes, and at about 9 minutes, I'll try and alert them with some kind of noise, maybe a bell. And after we've heard from our three panelists, we'll have a Q&A session for approximately 20 minutes. And attendees will be able to raise questions via Zoom chat as soon as we start. So can you please remember just to direct the question to the panelist you'd like to hear from. And I will attempt to get through as many questions as possible, because it's going to be very interesting, and I know there's a lot of interest, so great. Finally, can we just make sure that everyone's muted? I'm sure David's got around that. Right, let's get this exciting opportunity started. So the first distinguished panelist, Dr. Rui Maria de Araújo, was the Prime Minister for Timor-Leste from 2015 to 2017. Prior to this, Dr. Araújo served in the government in a variety of capacities, including Minister for Health, Deputy Prime Minister of Social Affairs, and he was appointed to the Council of State, which was then the top advisory body to the President of the Republic. He continued to serve in the health sector as an advisor to the Ministry of Health, and later served as senior advisor in the Ministry of Finance. In response to the emerging global pandemic, the East Timorese government declared a state of emergency lasting 3 months, March to June of this year. During this period, they established a situation room within the Integrated Crisis Management Centre at the Prime Minister's offices. Its purpose was to coordinate an intersectoral response to the pandemic, and Dr. Araújo was appointed the coordinator of the intersectoral task force and one of the spokespersons of the situation room. We are very honoured to have Dr. Rui Maria Araújo join us tonight. Our second distinguished panellist, Dr. Rajesh Pandav, has led Timor-Leste's World Health Organization country office since 2015. His association with the WHO started in 2004 as a short-term professional with the Mental Health and Substance Abuse Unit in the WHO Southeast Asia Regional Office. Since then, he has served over 4 years in the Maldives WHO country office in national public health, planning and program capacities. And in 2011, he became the Health Policy Advisor to the WHO Country Office in Timor-Leste. Prior to joining WHO, Dr. Pandav was a senior medical researcher both in the USA and India, and has co-authored several scientific publications. We're really grateful to have Dr. Pandav for sharing his insights on the panel tonight. And our third distinguished panellist for tonight is Miss Alzira dos Reis, who is East Timor Hearts Fund East Timorese Advisor, and whom will be speaking with that hat on tonight. Driven by her desire to serve others, Ms. Dos Reis first joined the Alola Foundation in 2003 as a volunteer. Her tireless work to advance the rights of women and children in Timor-Leste through a range of roles culminated in her appointment as CEO of the organisation in 2003. Ms. Dos Reis has also been on the board of several other women's organisations and NGOs in Timor-Leste. And she also runs a guest house. She is currently working as the National Planning and Monitoring Advisor in the Office of the Prime Minister. We appreciate Ms. Dos Reis' support and for East Timor's Hearts Fund, and also for being with us here tonight. A really very warm welcome to all panellists. And without further ado, I'd now like to invite Dr. Rui Maria de Araújo to open the presentations. Dr. de Araújo will be speaking under the banner of what has been done to prevent and prepare. Thank you, Dr. Araújo.
Thank you. Good evening, everyone. Well, good evening from here, Timor-Leste. And thank you for having me on this panel discussion. I would like to acknowledge everyone that is here, all the VIPs, Ambassador Peter, Timor-Leste's ambassador to Australia, to Malaysia, and all the others, and all the friends, all the new friends of Timor-Leste in Australia, who are all here in this session. I will probably not take much of the time allocated to me. I will just try to highlight a few points on the experience that we had in handling the COVID-19 pandemic here in Timor-Leste. The first kind of shots that were heard here in Timor were more or less late March. The government at that time had in place technical arrangements from the Ministry of Health to deal with the issue. But as some of you may already know, that we don't have quite yet a full legislative framework on issues related to quarantine, isolation, and so on and so on. So the state bodies had no choice but to declare a state of emergency in order to restrict some of the rights of the citizens, including the right to move around, the right to establish their residences. And that's one of the kind of constitutional and legal reasons why a state of emergency was declared at the end of March. And with the declaration of the state of emergency, things in terms of coordination of the prevention and control activities of COVID-19 was categorized as a public health catastrophe, and the command and control of all the activities were shifted to the Prime Minister's office, and that is also on the basis of the legislation that we have. So based on that, a situation room was established in order to better provide a unified approach the threat of COVID-19. Since March, one of the big decisions that were made was to close the borders immediately. At that time, we only had one imported case in Timor-Leste, which was who was quickly isolated in order not to transmit the virus within the community. Quarantine, isolation, and border closure were the main public health tools that were applied since the very beginning. Of course, as it happened everywhere, the first cases were provoking alarm within the community, and state bodies, in this case, particularly the situation room of the Integrated Center for Crisis Management, had to come up with a unified message to the people, and also delivering kind of confidence messages to the people, so that people won't be panicking too much, and would follow all the instructions and advice from the government authorities. So I think in terms of looking back to our experience, I think the fact that the government had taken the early steps once we had a positive case in the country, to establish a unified command and control mechanism for the prevention and control of COVID-19, and also a better coordination mechanism in order to make sure that not only government institutions, but all partners involved in those efforts were on the same page in terms of guiding all the efforts towards the same goal. So I think that in my view, that was one of the things that lead us to contain the spread of the disease. The second important thing that I would like to also highlight here is, despite the fact that we took quick action on border closure, quarantine mechanisms, and isolation facilities, we faced a lot of challenges in terms of infection prevention and control, because we ended up having a few imported cases, which we then realized that were the source of transmission within quarantine facilities. When, for example, by mid-May this year, some of the clusters were identified within some quarantine facilities, we realized that the challenge of infection prevention and control was not handled properly. And of course, after that, with the support of all partners involved, including WHO, the Australian government, all other governments, USA government, the China government, and all other development partners, we managed to improve a little bit on the prevention control mechanisms, and then contain further kind of let's call it nosocomial infection within the quarantine facility. So after that, I think quarantine facilities were better managed, including from a perspective of infection prevention and control. And I think that had led us to more than 90 days without any new cases detected. Only this month, August, I think, up until yesterday, I think 3 new cases were detected. making it all together now 27 cases, 25 positive and 4 probable cases. And then I think up until today, we still have 2 active cases. The one last point for me is that government had made the decision to extend the emergency state starting from this month. The Council of Ministers had decided another extension for another 30 days next month. And that is because constitutionally, we have to have a parliamentary law to impose quarantine measures and border closure and so on and so on. Unfortunately, as you may also know, that our political situation went through some impasse throughout these last months, and unfortunately, Parliament was not able to approve the appropriate legislation to enable the government to avoid continuously declaring states of emergency. But that is still a tool used for the public health contention of the spread of disease. So far, border closure, proper quarantine management, and isolation facilities had led us to the situation that we are at the moment. I think I will stop here, and then probably Dr. Rajesh and other colleagues would add more on that. And then if you have any questions, I'll be more than happy to answer. Before I go, to reiterate, of course, I'm not speaking on behalf of the government now, but as a Timorese, I would like to express our gratitude to all your support from good friends from Australia, who particularly Ambassador Peter, Ambassador Inez Almeida, who were, during those very tense periods, had supported a lot the work that we've done here. And so thank you so much for all the support so far. Thank you.
Thank you, Dr. Rui. I think we'll just keep going. And we'll hear from Dr. Pandav, who will also be speaking under the banner of what has been done to prevent and prepare. Thank you.
Thank you. Thank you, Sarah, and thank you, David, for having me. Good evening, everyone from Timor-Leste. Good morning, good afternoon. As I have seen that there are people joining from all countries, and good evening to all the excellencies, ambassadors, and who are listening there. As Peter said, that the strong leadership and decisive actions by the government and the government's plan and the solidarity shown by all partners, from bilateral partners, multilateral partners, to support the government of Timor-Leste to implement its plan for COVID preparedness and response has been the key. And that is why they have been able to control the COVID pandemic in Timor-Leste with just 27 cases. And at one point of time, as Dr. Rui pointed out, there were 100 days without a case, and in the last few days we have had 3 cases. A majority of these cases have been imported and within the quarantine facilities in Timor-Leste. And this has been possible mainly because of the decisive action taken by the government. And for example, within the health sector, testing of cases, treating and keeping people in isolation, and ensuring that those people coming from high-risk areas are being quarantined. There is also a ramped up surveillance system to detect new cases, including active surveillance by following contacts of confirmed cases to see if they develop symptoms. There has also been sentinel surveillance by testing people with respiratory symptoms who present at health facilities and hospitals, syndromic surveillance with collecting data on people with respiratory symptoms, but also community surveillance by checking on people who have recently crossed the border informally and being notified to the ministry by community members. So this is has been a good participation, and the testing rates have also been good. There are about 5,420 tests conducted till date, 27 positive. And outside of Delhi, almost 2,000 tests, about 40% of the samples were collected from outside of Delhi. And outside the health sector, as Dr. Rui has pointed out, that they have tightened the border through the emergency and restriction of immigration, and also introduced various public health and social measures such as physical distancing, masking in public areas, and setting up hand washing facilities, which these messages needs to be sustained. And the government and WHO has regularly put out information on how people can protect themselves and their families from COVID-19. So apart from this, the government is also supporting families and businesses with cash transfer, supplementary food programs, electricity subsidies, financial support, and various other things. And what was important, security, there is no economic security. And this has been translated through the CIGC and all sectors of the government supporting this response from the government. And also the Ministry of Health has taken care to ensure that the essential health services are not been affected. And we also don't want any other epidemic to come out, for example, measles epidemic, where Timor-Leste has done well in controlling the measles epidemic. So they have been take active efforts to ensure that the routine services are brought back. Initially, in the early periods of March, there was a dip in the immunization rates, but now with support from all partners, the Ministry of Health has been able to actually increase the immunization rate past the pre-pandemic care. And while the government is taking strides to improve the health systems, there needs to be improvement in the quality and the number of quarantine facilities and isolation centers, and also in terms of the ability to manage critical and complicated is currently limited. And so if there is a surge in cases, it is likely that the health systems will be overrun. Therefore, the importance of making sure that all the public health measures are followed and we control the border, people are put in quarantines when they enter the country for 14 days. And all of these measures need to be strengthened. And so the most successful strategy, as Dr. Rui has already pointed out, has been the compulsory quarantine of travelers returning to the country for 14 days in government identified facilities. And this has really helped to prevent community transmission. And also in terms of health budgets, the government has recognized this and is supporting the national response by allocating extra emergency funding for COVID-19. And this not only includes funds for the health sector, but also for the socio-economic recovery, such as cash transfers for families and supplementary feeding programs. I mean, moving forward, Timor-Leste, to keep Timor-Leste safe and virus-free, I think there are 6 important steps of all of government and all of society response to keep Timor-Leste safe. 3 of them are from the health sector, 3 from outside the health sector. For example, we must escalate our test, treat, trace policy. All suspected cases must be tested, and those found positive must be treated in isolation and their contacts quarantined. We must accelerate our expanded testing policy. All people presenting with respiratory symptoms to health facilities and hospitals must be tested for coronavirus. We also need to improve, as Dr. Rui pointed out, the quality of the quarantine facility to ensure good infection prevention and control, and also the quantity of the quarantine and isolation facilities as more people are returning back to the country. A lot of charter flights are coming in, so there will be an increased number of people entering the country. We also need to ensure that the essential health services do not suffer. We don't want another health crisis on top of COVID-19. And then outside the health sector, we need to control and manage the entry of people from overseas, ensure all of them spend 14 days in secure quarantine facilities with 100% compliance. And the reopening of the borders must also be based on a thorough risk assessment. People should continue to follow sensible public health interventions such as frequent hand washing, good cough hygiene, physical distancing, masking, and most importantly, staying at home and seeking medical advice if unwell. And the government must continue to support our people in adhering with these stringent restrictions by extending the very helpful support such as cash transfer, feeding programs, and others. So overall, I think both the public health response, the response on socioeconomic recovery, and the leadership and decisive actions taken by the government, and to re-emphasize the solidarity, the partnership, the support from Australia, European Union, China, US government, many other governments and other agencies have all worked. And the partnership at the ground for WHO with all the Australian supported NGOs has been excellent, and all are working towards making sure that we support the government of Timor-Leste. And thank you.
Thank you, Dr. Pandav. Very interesting. Now, our final panelist is Ms. Dos Reis, and she will be speaking to what is the situation on the ground. Thank you. You need to unmute.
Thank you. Good. Yeah. Thank you, Manasara. Good evening, everyone. And His Excellency Ambassador, I would like to thank for East Timor Heart Fund for giving me opportunity to share the experience that people on the ground face during the COVID. Yeah. In almost all the COVID affected countries, entire educational, commercial, sport, and spiritual institution, which has closed, and it has been experienced by people living in urban and rural area in Timor-Leste. Since Timor-Leste first case detected until now, there are no reported local transmission. The only confirmed case is imported. During the COVID-19 pandemic, it shows that different views, thoughts, experience within the societies in urban area, municipal, village level in terms of how to tackle the pandemic. I would like to present what has been experienced by the people on the ground. It's same with the other country. It's affected to the people, for example, less of income, lost their job, high expenses, which are leading to the stress of the family member because there are high expenses and then there is less income. Based on the data in Fountil, that there's about 120 employer that didn't like they didn't let they cut the salary of the worker, and also it's like 86 domestic worker that need to terminate their contract because like the employer they don't have income to pay them. And also lockdown itself also in some people it is like strengthening the relationship in the family, but in some family it's leading to stress, and then it also increased the number of domestic violence. The data from the Secretary of State from Promotion Equality, in July there is about 243 domestic violence cases that there. But in some cases, in the women's movement, they found out that there's some cases which not reported because they don't have encouragement, and also because they think that when I report to the police, I'm worried about I can affect COVID, so they didn't go to report their cases. In some issues regarding to the shortage of food supply in household. Yeah, so when the first case announced throughout the crisis in rural area have been, they think that when first case announced, people think that safe place from virus is in urban in rural area, so they go to countryside. Like for example, I observed that some students, because there is no school, so they all going back to their village. And also some people living in urban area, they think that because the COVID is in urban area, I need to avoid myself. The good shelter for me is going to countryside. But that's a challenge, that issue that on the ground. But there is a significant mobilization in urban to municipality to responding to the pandemic situation, include human resource mobilization, and make available support and equipment as much as we in Timor we have, through the collaboration between the relevant stakeholder, includes government, development partner, civil society organization, to respond to that, as been mentioned by His Excellency Ambassador and then other two speakers, that there is a really good collaboration between the civil society and development partner and also government to respond to the COVID. I observed that there are raising awareness activity for the prevention conducted in urban to village level, which must comprehensive, that has been implemented by relevant stakeholders. It shows that most people eager to know information on the how to prevent and want to follow up the cases progress itself in Timor-Leste. But in other hand, the organization that I work also, some people in rural area doesn't want to participate in the prevention activity because they assume that facilitator can be transmitted COVID to them because the facilitator is from the national, but after the explanation, and then they agreed to participate in those prevention activities. The positive things that we learn from this situation in ground level, which it has built up a strengthening spirit of solidarity to most needed in distribution of basic needs, food, hygiene, kits, clothes, in urban and rural area too. And also it has been like in some household, they using a barter system in exchange food, which shows that how community members share responsibility, share what they have in responding to the problem that happen in the community. because in one household that have been visited by the organization that I'm affiliated with, they butter the rice with the sweet potatoes because their kids, they don't want to eat the sweet potatoes. They think that rice is the really nutritive food. So their awareness is still low. So they try to like exchange the food. It's also the positive things that we learn from there is it helps the strengthening relationship within the family. Even I have been mentioned that there's also some family that there's a case of domestic violence, but in some family during the COVID, because it's just a stay at home, so it's strengthening relationship between the family member itself. And also it has been increased understanding on importance of hygiene. Some some household, they start to regular washing hand become habits, and they also create their own hygiene things that they can put water, because in their area they don't have they need to go to like 1 kilometer to collect the water, but they create their own things to put the water to wash their hands. So that's things that the like positive change that happen in ground level. As mentioned by other panelists, there is some support from within the community itself. It's a volunteer support, but also government established policy and provide subsidy for household with subsidy, $100 for each family. So there's around 305,000 household has been get support for 2 months with a total amount of 61 million across 20 municipality, and also include the Oikusi James itself. Apart from that, there's also support on the electricity subsidy, $15 a month for the household. So I think so far to cope that situation, there is a really good collaboration and partnership between the all relevant stakeholders, and put the integration plan that there which has been designed by the Center of Crisis, become their guide to develop their own plan within the other organization. And on the ground, they feel like that it's really like there is a support from the government. So I think that's all from my side. If there is need a clarification or some question, and I'm happy to respond to that. Thank you. Thank you, Mana.
Thank you. Sorry, I was just trying to unmute myself. Thank you very much. Well, thank you all very much for enlightening and interesting commentary. I'm sure there's lots of questions. So I'll now open the Q&A session. And remember to send that via the Zoom chat room. But something that struck me, if we can go back to the beginning of Timor-Leste's response to the pandemic, I think Alzira mentioned something about messaging at community level. And I just wanted to ask Dr. Araújo, we've seen quite a bit of panic here in the community, in Melbourne at least, in the early stages of the pandemic. And we've had lots of challenges getting the right message out at the right time to the public. I wonder what sort of strategies you looked at and then used when in your time during the time that you were in the Integrated Crisis Management Centre. How you disseminated the messages. Yeah, we'll start there. Thank you.
Thank you, Sarah. I'm sorry I didn't get the whole of the question that you posed, but the last part of it was quite clear to me. During the first 3 months of the state of emergency, so it was between March and June, the main vehicle or the main way we communicate to the public was daily press conferences released through the television network, where we will talk about the cases, the daily progress of the cases, and also talking about important messages that we need the community to know. At that time, we had three or four spokespersons dedicated to specific issues, and on a round basis, we went to the public briefings, media briefings every day. And we also had a Facebook disseminating some of the informations, particularly targeting the young people, students. We also had regular interviews within the main TV channels, talking to the media, but also the Ministry of Health and the Ministry of State Administration, which is more or less in charge of the local administration institutions. They would send teams basis to spread the important messages about COVID. I would not go through all the details, but there was more or less the way we tried to disseminate all the information about COVID. But the most important one was to have daily media briefings with direct relay to the people.
Sorry, am I unmuted? It's a little bit hard to tell. Yeah.
I can hear you now.
Okay, great. Thank you. Thank you, Dr. Rui. That's great. Look, the other thing I'd be interested to hear probably from Mr. Reis is just in terms of messaging at Aldea and Sukor level. Are there interesting health beliefs around what the virus is and is not, and how is that being dealt with?
Sorry, Mana, I can't get all the questions, so can you please repeat again?
You were talking about different belief systems. Am I off mute? Sorry, technical. And I'd be interested to know at an Aldea or Sukor level, whether or not there have been some interesting health beliefs around what the virus is and is not, just from a cultural perspective.
In the Suku level, they believe on this pandemic, so they also conduct some ceremony, a cultural ceremony, to asking for the protection. So there is some ceremony that happened in some village that they conduct ceremony, and then they asking for protection from this COVID, because they believe that there is COVID. So that's in the Aldea level. But in terms of the socialization of the prevention, how to prevent, there is several organizations come to village, include the in health post, and also there is a civil society organization that came on the ground and then sharing information about that. Yeah.
Thank you very much for that. Questions. We've got a few questions. The next one's come through. I don't know who it's from, but I'd like to ask Dr. Pandav around surveillance. What sort of surveillance has been and is being implemented for COVID-19? You did mention expanded testing and also something else around symptomatic referral with chest-like or respiratory symptoms. Could you describe a little bit of that and how you've upskilled and upscaled? Thank you.
Yeah, so as said earlier, that one of the strong point of the response has been a strong surveillance system of the Ministry of Health, and all the health staff, and with additional surveillance staff being trained by WHO and various other organizations. So first of all is active surveillance, that following the contacts of a confirmed case to see if they develop the system. So the contact tracing has been very good, and every contact has been followed of the case and tested. So that's has been very good. And there's also been sentinel surveillance after the during the first 3 months, where there was expanded testing for people with respiratory symptoms from all the municipalities to see if there is any evidence of any community transmission, and also collecting data on people with respiratory symptoms there. But one other interesting aspect in terms of community surveillance, that the border across Indonesia is porous. So the Alzira chief or the Suko chief, if there is somebody who is detected who has crossed the border, they would be reported, and then the health staff would go. So this strong surveillance has helped, and good contact tracing. And the Ministry of Health staff have responded along with all the partners who are supporting the surveillance system in Timor-Leste. Over.
Thank you very much, Dr. Pandav. I have another question that's come through from Inga Mempham. She asks, what do you think could be the long-term consequences on the Timor-Leste health system? Positive or negative, she's asking, because of COVID-19.
You want me to answer?
Please do. Yeah.
Yeah. So, as you know, Timor-Leste's health system is still developing, and some of the long-term effects of this would be, reduction in the essential health services, and there has been efforts made towards making sure that the essential health services are back to normal, but that needs to be increased investment in that. So I hope the positive consequences would be, and as pointed out by His Excellency the Prime Minister, that health first. Without health security, there is no economic security. So the positive consequences would be more the health budget increasing, more support for Ministry of Health and all the areas which relate to health, more investments in water and sanitation, providing good access to water and sanitation. That would be some of, and also the trained staff who are doing surveillance, contact information, and as Peter pointed out, these gains would be useful for addressing other communicable diseases towards making sure that there is a control. We already see in the world that influenza-like illnesses, there has been a reduced burden of this, possibly due to the protective measures followed by the community, hand washing, wearing masks, the good respiratory hygiene. So these good public health practices will continue. And another important part, and I think you asked the question about communication, empowering the community is key to this. And so this COVID-19 has given the opportunity to educate the public about what we need to do to prevent infections to themselves and to the others. And this will go a long way in preventing other illnesses. So there are several gains from this and several challenges to address. Both positive and negative will come out of this. And I hope through this, the health system becomes stronger. There is more investment in health, not only in terms of financial, but capacity, strengthening the laboratory system, strengthening the preparedness and response to other communicable diseases. Over.
Thank you, Dr. Pandav. Before I go on to the next question, I'd be interested to hear, in relation to that question, your opinion on the current HIMS system in relation to capturing the current trends in morbidity and mortality under COVID-19. I think one of you mentioned that initially, or it was you, Dr. Pandav, initially measles and immunisation coverage went down, but now it's back up. Could you speak to that, please?
Yes, so experience from all across the countries affected this virus, and also a recent WHO survey of 103 countries, including Timor-Leste, has shown that there has been an impact on provision of essential health services. And the health information system of Timor-Leste is also developing, needs to be strengthened. But one good example of the health information system is the immunization coverage, which has been tracked regularly. And in the month of March, there was a dip in the immunization services. But this was addressed quickly by developing and adapting the guidelines for immunization in the context of COVID, and with support from WHO, UNICEF, Gavi partners and partners on the field. There was a comprehensive response to improve that. But there are other services for mother and child care where the data is being collected, and these need to be addressed. So far, there has been no deaths due to COVID-19, but data on excess deaths due to other causes is also important to fully understand how this has affected, the pandemic has affected this. So this is in work in progress. As I said, this is also gives an opportunity to invest in strong health information systems, strong surveillance systems, and in the coming months we will have better information about this and how we can collectively, the ministry can collectively address, along with partner support, to address some of the issues which affect the other essential health services. But the response from the government has been, they are very cognizant of this, and they don't want, they have been able, there are some gains made, especially for immunization. For example, measles was declared eliminated, rubella control, polio is not there for many years, and they're moving into new vaccine programs. So that's the gains made in the last few years. The government is fully cognizant that they need to
No, Dr. Pandav seems to have left us. Wait a minute. Okay, I might move on to the next question until we can get Dr. Pandav back. And this is from Jeff Fraser Goff for Dr. Rui or Dr. Pandav. So Dr. Rui, are you happy to take this? I'll read it first. What is being done to prepare strong systems and response plans in the hopefully unlikely event that COVID-19 does escape from quarantine? And I think it's more also about if there's a resurgence and more outbreaks or clusters. Thank you.
I think I'll mention a few points here, and probably Dr. Rajesh would also add on that. I think surveillance is one of the key tools. At the moment, from what I understand, people at the community health centers and at the regional level, they are still keeping a list of those people that came through the quarantine process. And from time to time, they will, through the surveillance system and the contact tracing teams that are being established at the municipal and community health center levels, they will contact regularly those people and then make sure that any respiratory syndrome coming up will get good attention and immediate access to testing in order to prevent any unnoticed spread within the community. So to answer that question, the surveillance mechanism has been established down to the community health center level. So far, no noticed case had been escaped from quarantine. And I think the other instrument, the other tool that is also being used is the syndromic monitoring and testing of cases at the community health center. I don't have information at the moment where this testing is still going on at the community health center level, but a few months back, community health centers would do testing to people coming to the community health centers with any respiratory syndrome. Over to you.
Thank you, Dr. Rui. Have we found Dr. Pandav? Is he back? David, if you could help me. Ah, welcome back.
Yes, sorry, I left you last. Yeah. So I was hearing Dr. Rui, and I agree that in the initial months of the response, the surveillance systems were strong, and there was a dip in the last couple of months, 2 months, in the active surveillance going on in the community, and with now is in the process of being picked up. So that needs to be strong, the surveillance system, at the community health center level, at the national hospital, referral hospitals, and especially in the border areas needs to be stronger, and this needs to be further strengthened. So that's one of the key issues. And also, as I said, there needs to be strides taken to improve the health system, improve the quality and the number of quarantine and isolation centers, and also the capacity to handle critical and complicated cases. Because if there is a surge in cases, it is likely the health system will be overwhelmed, and therefore it is critical that we continue to strengthen all those interventions that will limit the entry of virus into Timor-Leste. And the most successful strategy to till date for Timor-Leste has been compulsory quarantine of travelers returning to the country for 14 days in government identified facilities. And this has really helped to prevent community transmission so far, because most of the cases have been imported. Over.
Thank you. Next question is from Dr. Helen Hill to Dr. Pandav. Is all the health messaging about hand washing, etc., having any spin-off effects for other diseases such as reduced cases of the flu? It says TB, but transmission is slightly different.
Yeah, so yes, and I address maybe this, as I mentioned, all over the world, there has been a reduction in the influenza cases detected. So this possibly due to the hand washing, good respiratory hygiene measures, even in Timor-Leste, in fact, benefited from a pandemic influenza preparedness, and the laboratory being a laboratory and the surveillance system activated for influenza for a couple of years, which was used for this COVID-19 situation. So we see that with these measures, there has been a reduction, but also this needs to continue. The message about hand washing, good respiratory hygiene, masking in crowded places, physical distancing, all of these need to continue to happen, and every individual needs to feel empowered, because every individual has a role in this pandemic, and this message needs to go across the country in villages, in hamlets, and everybody needs to take responsibility of it. You can see the benefits of influenza, but over a period of time we will know more how this has benefited. Over.
Thank you. Another question about health staff. How are you dealing with surge capacity in terms of number and training and PPE? Dr. Rui, Dr. Pandav, can I invite you, either of you?
Yeah, so yes, Dr. Rui. Yes, so yes, the Ministry of Health has recruited additional staff for surveillance also, but there are also several trainings conducted through partner support, WHO, other organizations working together, Australian organizations, Maluk Timor, Menzies, St. John of God, all working together to support the Ministry of Health, especially for the health professionals on clinical management, but also on basic hygiene measures. So there has been an increased effort to ramp up capacity, train capacity. There have been trainings conducted at the national level, at the municipal level, at the community health center level. And this has been a really collective partnership between many organizations to support and great solidarity shown by all partners to enhance this training of all the health professionals. But there are certain areas, as I pointed out, in terms of handling severe to critical cases, more needs to be done in terms of enhancing the capacity of the health system to deal with that. And Dr. Rui maybe would like to add.
Dr. Rui?
Well, I don't have much to add on that. I think on the surveillance side, I think the human resources. On the surveillance side, I think the human resources is well equipped, and also it's good in numbers for them to do the work on the surveillance side. But in terms of treating more complicated cases, and I think Dr. Pandav had already mentioned that treating more complicated cases is one of the weakest points for us, and that's the reason why we are focusing a lot more on early detection of imported cases and avoiding that those imported cases are entering the community.
Yeah, thank you. So we have a question from Ingrid Svensson to all panelists. How can Australia help and what do you need? I think that's as a generic thing under COVID, but again, as I was asking you around, should there be an outbreak and the need for surge capacity? I think it's twofold really. All panelists who like to take that one.
Okay.
I can go first.
Okay.
Sorry.
Yeah.
Yeah, I mean, Australia is one of the major partners of Timor-Leste development assistance. A large portion of development assistance comes from Australia. So their investment is basically to improve health, but also other areas, water, sanitation, and a lot of economic collaboration is key. In addition to specifically for health, and if there is a surge in cases, you need to ensure that the isolation facilities and the treatment facilities have enough PPE supplies, equipment, and other things. So that continuous support needs to be there, in addition to enhancing the capacity of the health professionals of Timor-Leste. Over.
Yeah. From my part, I think what the Australian government need to support Timor-Leste is support the implementation of economic recovery plan that have been approved by the council ministers, and then Dr. Reis is the one of the focal point on that. So because the economic recovery plan is covered several pillars there, so it can be also, if Australian government continue to support the implementation of economic recovery plan, it also will lead to the recovery of the economic of farmer, of the small business group, and also in part of the education and health is there. So I think from my part is this. Yeah, over.
Thank you. Do you have anything to add, Dr. Pandav? We'll move on to the next one because time is running.
Can I? Hello, it's Peter here.
Yes, Peter.
I might mention something. I'll say something on behalf of sort of official cooperation and then more broadly for Australia. But first, I think, I mentioned when I first spoke the positive lessons that we're learning. So I think, a big opportunity now for cooperation from Australia with Timor-Leste is to double down on those lessons that we've learned. So we go through a process now where we're meeting all ministers to say, what do we do in this second phase? I'm not saying second phase COVID, I mean second phase where we look both at the health response but also the economic response. So Alzira, I'm really happy you mentioned the economic recovery plan, because we're very, very keen to sort of look at that next step, because we know resilience is so important, and addressing the economic and social impacts of coronavirus is going to be just as important. So we're very keen to get behind programs such as social protection programs, such as Programa Nacional de Desenvolvimento Suku, such as working with agriculture and so forth. So I see a big new opportunity there. And look, I make the other observation, there's so many Australian friendship groups and NGOs who are doing good work in Timor-Leste. And I think what we all have to do, and this is a comment for the embassy as well, we need to keep being driven by Timor-Leste's priorities and identified needs. And I think it's a really nice mix in Timor-Leste for Australia, because we have different groups who can work at different levels. An Australian embassy is not going to be the most effective group to be doing grassroots work out in certain villages, but we can be doing more systemic things, and we can be working through our NGO partners. So I think there's a lot of opportunities to cooperate, and I think the biggest lesson for us all, us, me included, is that we have to listen and be driven by Timor-Leste's priorities.
Thank you. Question from Barry. Has there been discussion and planning for procuring and distributing COVID vaccines across Timor-Leste? And have other countries pledged a contribution of their stock to support a collaborative response to vaccination?
Hi, I can take this one if you like.
It's open, the floor's open.
Yeah, because just yesterday or the day before, Foreign Minister Payne announced a contribution of $80 million from Australia to Gavi, the Vaccine Alliance. And this is about securing access to vaccines for our neighbours and close partners. So that includes the Pacific and, of course, Timor-Leste. So if you pop on over to our Facebook page, you can read details of that announcement. But I think it's a big sort of focus for Australia to make sure that all of us in the region get access not just the richest.
Yeah. Would anyone else like to add? Okay. Dr. Rui, there's one question here for you. Going back to the beginning of the pandemic again, what were Timor-Leste's triggers or influences? This is from Ruben David. In deciding on timing of critical early response in managing COVID-19?
I think I would start by highlighting that from the fact that the first case was an imported case and there were no community transmission of cases in the country. So the first quick decision that the government had to make is to close the border, not to leave the border open for entrance of people every day as it was before, because we did not have enough facilities to compulsorily quarantine everyone. So the first decision was to open the border kind of weekly, particularly the land border with Indonesia, and then all the domestic flights were being kind of reduced in numbers up until the point where only flights from Australia were allowed to come in, particularly to bring in supply and logistics and so on and so on. So the main influx of people coming into Timor were from the land border. On average, before the decision to close the border, on average, every day there will be around 100 people coming in. So facilities for compulsory quarantine were not enough. So the government had to make that decision. So the idea of having compulsory quarantine was, in my view, was one of the main triggers for us to close the border and then start to manage the influx of people from Timor on that basis. And that is still going on up until now. Under the current state of emergency, I think the border is open every 17 days so that it can give space for the government to prepare for facilities for people who are coming from the border.
Mm-hmm.
Over.
Thank you.
Yeah, if I could add.
Yep.
Yeah, the question about the vaccines, so as Peter mentioned that, vaccines are important. So the COVAX facility, which is a collaborative effort between CEPI, Gavi, and WHO under the ACT Accelerator, the Access to COVID-19 Tools Accelerator is very important. And one of the two important objectives of that accelerator is the fair distribution of COVID-19 tools, including and their accelerated development, including vaccines. So distributions of vaccines is a very important topic that WHO is working with the member states to address. WHO, along with Gavi and CEPI as part of the ACT Accelerator, is presently working on a proposal for a fair and equal allocation mechanism in discussion with member states. This addresses the issue of who would have priority in accessing the vaccine first. For example, healthcare workers, essential workers, and other vulnerable populations, and how groups could be progressively prioritized as more doses of vaccine become available. What is important is vaccines are a global public good. This is because we benefit if others are vaccinated. It is in all countries' interest that the vaccine is made available across the world. There will be no true global, including economic recovery, unless all parts of the world are able to bring transmission under control. Over.
Thank you very much. We're running way over time. I'll take two more questions. And the next one is from Antonio to Dr. Rui and Dr. Pandav. How has the government ensured that the people get access to clean water for hand washing?
I think Dr. Pandav can better answer that question.
Right.
Yeah, so initially when the first cases were recovered, so there was a lot of effort made to ensure that there are hand washing facilities available at all across the country, and there was several partners and donors, including Australia, who supported the establishments of these new facilities for hand washing and all. But there needs to be an overall major investment in ensuring that water and sanitation facilities are available on a long-term basis. So, including for health facilities, including for general public. And I think the government is cognizant of this fact and in the process of having collaboration with partners, donors, other donors to ensure that these services improve. So there lot needs to be done in terms of providing access to water, hand washing facilities, and improving sanitation. Over.
Thank you. The next question, the first, second last, or the second last? It's from Joanico Oliveira to Dr. Rui. What are the main challenges ahead, given the country now has more registered new cases, or positive cases, I should say? And are there concerns of political tensions?
I think at the technical level, the Ministry of Health, with the support of all the partners, the Ministry of Health is doing a good job. Politically, there is the risk for tensions is at the moment quite low. There is a government in place. The government is discussing the budget at the moment. We hope that things will move ahead. Of course, we hear people trying to come up with some sort of protest against the president and so on and so on. But to me, these political kind of movements will not, in my view, affect the way the country as a whole is trying to prevent and control the spread of COVID-19 here, because the lead agency, the Ministry of Health, is technically well placed to do the work, particularly with the support of all the development partners, and also with the support from other technical ministries on the ground. So I don't think the political tension that could probably come up will derail all the efforts that are now in place. Yeah. Over to you.
Thank you very much. And a final question, this is for Alzira. Is there anything unexpected that has happened that you've noticed or you want to share?
There's just one unexpected that I want to share, because one thing is about we are now, the government and its focus to the COVID-19, but there is also some case that happened that decline the number of the people access to, especially women, access to antenatal care, and then also postnatal care, because the number is reduced. And also, we also in the organization, one organization that I work with, there is some like a pregnant mother that she doesn't want to go to deliver at health facility because she's worried about the COVID itself. So she's giving delivery support by the traditional birth attendants. So actually, when we are talking about the COVID, we support our focus to prevent the COVID itself, but how about the other health service? So, on the ground, that's what we found. Yeah, over Mana.
Yeah. So possibly access to health services, for some demographic groups is an issue.
Yeah.
Okay. Thank you. I'm going to keep moving unless there's anything else anyone else wants to ask quickly. It's nearly 9 o'clock, or it is 9 o'clock. Okay. A heartfelt thank you to all three panelists. Thank you so much. It's been thrilling to listen to your expertise and experience over the last hour, or a bit less, but it was going to be 20, so really appreciate that. And I'd just like to wrap up by asking each of the panelists one or two take-home messages from your experience so far within either the framework of what you discussed tonight, or indeed on the way forward, Timor-Leste under COVID. So if we could start with, let's start with Alzira. One or two key messages.
The COVID-19, my message is, as I mentioned earlier, the COVID-19 outbreak affect all the population, and particularly to the members of those in the most vulnerable situation. So sharing the responsibility to give hand to others is needed, especially the people living in poverty situation, include women lead a household, victim of gender-based violence, older people, person with disability, youth. So I think give a hand together and then help each other is needed, and stay safe for everyone. Thank you.
Thank you. Dr. Pandav, would you like to comment?
Yes,
one or two key messages.
Just one key message. Timor-Leste has done well in this pandemic so far. In fact, one stage we went 100 days without any case. And one of the main reasons for this success was Timor-Leste's smart immigration strategy. Therefore, Timor-Leste's fragile and developing health system will be overwhelmed by a surge in cases, but this they have been able to shield the health system by making it compulsory for every person coming in the country to spend 14 days in a quarantine facility identified by the government. This single factor has been more important than any other preventing spread of virus in our community. And my plea is that this continues through this crucial intervention, and also empowering the community with correct information. So these are basically the key messages I would like to give. Over.
Thank you. Thank you very much. And finally, Dr. Rui.
Thank you. Thank you for having me on this interesting panel discussion. Thank you, everyone, for the great questions as well. I think things will never be the same again for all countries and for people in the world as well. One of the greatest challenges that I think particularly small developing countries like Timor will face is how to manage the reliance on the mobility of people, because we are talking about economic diversification, having tourism as one of the main areas of economic diversification for the country. So at some point we'll be having a kind of lockdown fatigue. People will have to, find ways to travel, go out, and then come into Timor, and so on and so on. So this is going to be the biggest challenge, and there are no answers yet to that. And I think the sharing of information, these kind of webinars, changing of knowledge and information will help a lot countries, including Timor-Leste, to better face the challenges of post-COVID in the future. Thank you so much.
Thank you all so much. It's been really, really great. But I'll move on now. We are having a little poll, so a small reminder. David wants me to remind everybody. It will be launched shortly. If you could provide some feedback, that would be appreciated and very helpful for fine-tuning future webinars. And we hope you can all come back, especially the panelists. And once again, thank you so much. Now to make some closing remarks, it's with great pleasure that I would like to introduce Her Excellency Miss Inés Maria de Almeida, the East Timorese Ambassador to Australia. In August 1975, Her Excellency and some of her family members left East Timor as refugees when civil war broke out. By 1979, she was involved in East Timor's Cultural Centre, supporting activities for self-determination. By 1992, Her Excellency was part of a small group that founded the Sydney-based non-government organisation East Timor Relief Association, or ETRA. ETRA worked to spread awareness of the struggle for national liberation through radio, bulletin, and relentless contact with solidarity groups to get logistics and financial support to the armed and clandestine fronts. Her Excellency has also actively participated in all intra-East Timorese dialogue meetings held in Austria from 1995 to 1998. She also participated in the East Timorese National Convention at Peniche in Portugal as a member of the National Council of Malbere Resistance. She has contributed to international conferences for over 12 years to establish international solidarity for the struggle of East Timor's independence. And in 2009 was awarded the Order of Vanuatu from the President of Vanuatu for her activism in the fight for people's liberation. I want to apologise for the lateness of this, but Her Excellency Miss Inés Maria de Almeida with some closing remarks, and thank you.
Thank you, Sarah. Hello, everyone, all the VIPs that are listening. To East Timor Hearts Funds, I really appreciate you organizing this event. It is a great opportunity for everyone to listen to firsthand what has been happening in East Timor. Tonight's discussion epitomizes the great partnership between governments, civil societies, and development partners delivering health services to the people of East Timor. Here in Canberra, we watched closely the development in Timor-Leste since the outbreak of COVID-19, and we watched it with pride, but at the same time with concern for those fighting on the front line with limited resources. Our health professionals work tirelessly, and their determination to keep our citizens safe has been remarkable. Ambassador Peter Roberts, through your commitment and support, you have shown the strength of our bilateral relationship and what friendship is all about in times of need. I hope we can continue to protect the health of the people of Timor-Leste well into the future. Last but not least, to all the health professionals and volunteers of East Timor Hearts Fund, my great appreciation. You began your journey in 2010, and a big thank you on behalf of the people of Timor-Leste. You're not only mending hearts, but most importantly, you're saving the lives of our people. So to everyone, thank you very much. Stay safe. Over.
Thank you. And now back to David. Thanks, David.
Thank you. Thank you very much, Sarah, for moderating such a fantastic discussion. Thank you, Dr. Rui, Dr. Rajesh, and Alzira for a brilliant panel discussion, amazing, and a special guest panelist, Peter Roberts. Thank you for your contribution, and what Australian organisations and Australian government's been doing is fantastic, as has a number of other countries' cooperation and collaboration with the Timorese people. It's been fantastic. Thank you for Her Excellency for your kind words at the end. I'm sure our medical people who are, our medical volunteers who are on the line really appreciate that. And I want to thank everybody for their collaboration and cooperation tonight, but also through the pandemic and all the good work that's been done. I hope I'm not keeping anybody from their dinner, and I want to thank all our supporters, our volunteers and our guests. I refer you, for people that might be new to East Timor Hearts Fund, to our website, easttimorheartsfund.org.au, very easy to find. Also our Facebook page or our Twitter, and can recommend Dr. Rajesh's Twitter for his photos in particular, and Peter Roberts's Twitter account as well, on what Australia's doing and what the embassy's involved with. Thanks to Kim and Diana for their behind the scenes work. Thank you everybody, and have a lovely night. Thank you all.